Good morning, everyone. You know, if you suffer from joint problems, mainly hip issues or pain, Dr. Casey Tabor with San Antonio Orthopaedic Group is here with some very valuable information. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
And thanks for bringing the hip visual here.
I know you like visuals, so we brought it.
Makes it easier for us here. Okay, so let's talk a little bit about hip replacements. And you and I were just discussing the fact that, you know, it's not just older people that have hip issues. Correct?
Right. Actually, a lot of younger people have issues, and they don't always need hip replacements. Most of your hip replacements are in the 55 to 65 age range, into the 70s. But there's a lot of young athletes that are still playing and still, and by athlete I mean just anybody who's active, out running, working out. You know, you may be a 36-year-old or 40-year-old athlete, but you're not competing with somebody else, but you're competing with yourself every day, and
on the treadmill.
And so they frequently have hip issues, and it's not necessarily hip replacement, but
and there are things you can do for those issues as
well.
But today, I guess we're going to talk more hip replacement, and there's some wonderful technology and things that you're doing that's really making a difference for people.
Right. There's been some newer techniques, and as time goes on, we're always evolving new medical technologies, and one of them is the anterior hip replacement, which is a much less invasive type of procedure. It's still a hip replacement just like the old traditional ones are. It's muscle sparing though, which allows you to recuperate faster, allows you to have less pain afterwards, less risk of dislocation afterwards. So it's a nice procedure, and it's something that only a small percentage of orthopedic surgeons do. Which is you. Correct.
You are in that percentage. So how does a hip replacement work? And you brought the model here. Could you kind of briefly show us what
so
involves?
This is probably the best example of it, if I can get this thing out. Yep. So this is the femur bone.
Okay.
And basically what happens is as people start to get arthritis, which looks like this,
no good.
When their cartilage starts to wear out on the ball and the socket side, we replace the ball with, wrong side, we replace the ball with a new ball. It's usually a ceramic or a metal ball, and the stem itself is metal, and then we replace the socket with a metal socket and plastic that goes into that. And so the plastic kind of takes the place of the cartilage that's lost, and so you have new motion without it grinding and catching and popping, and you regain your motion. You're able to walk without pain.
It's got to make you feel so much younger, like you've got your young hip back.
Well, of course it does. If you can't, my biggest complaint from patients is they can't put their socks and shoes on. They can't get in and out of a car, in and out of a bed. And those things are things that we take for granted every day, but if you can't do those on a day-to-day basis, it's a problem.
Yeah. Well, if you would like more information, if you are dealing with, again, the hip issues, if maybe you're thinking you could possibly need a hip replacement, Dr. Casey Tabor with the San Antonio Orthopaedic Group is here for you. He is magnificent. You can call them at 210-804-5400. 7 convenient locations, so you're sure to find one near you. You can also go online to TSAOG.com. Dr. Tabor, thank you.
Thanks for having me.
Thanks for the demo. That was awesome.
Thank you.
All right, guys, we'll be right back.